All right, let's do a little bit of the background of blood pressure, okay? We're going to go a little bit more detail in a second video, but let's start off general for now, okay? So basically, for blood pressure, there are a couple things that need to happen in order to maintain a decent blood pressure, okay? Sometimes we're going to need to shunt blood to the core, away from the skin. The way we do that is we vasoconstrict the blood vessels that are in the skin. So they go from being normally dilated to constricted. And when we do that, we shunt blood to the core. How does that happen? Because we target alpha-1 receptors that are located in the smooth muscle surrounding the blood vessels in the periphery. So they're called peripheral blood vessels. As a result, the patient's going to look pale. Conversely, there are going to be times when we want to shunt blood to the skin away from the core. And it is exactly the opposite of what we did to shunt blood to the core. Okay, so we're going to vasodilate blood vessels going to the skin. So that means that the blood vessels in the skin are going to go from being normal to dilated. How are we going to do that? We're going to block the alpha-1 receptors that are in the smooth muscle that surround the peripheral blood vessels. In this case, the patient's going to look flushed or red because of an increase in blood flow to the skin. Okay. The third thing that we need to understand is that we have beta-1 receptors that are in the heart. So remember, you've got one heart, two lungs. Beta-1 receptors are in the heart, beta-2 receptors are in the lungs. Okay. If we target beta-1 receptors, if we turn them on, if we activate them, we're going to jack up the heart rate. If we block beta-1 receptors in the heart, we're going to lower the heart rate. And there is a whole classification of drugs called beta blockers that are designed to keep heart rates low.